Good evening. Health officials in California are raising alarms tonight as cases of whooping cough, also known as pertussis, surge to their highest levels in years. This highly contagious respiratory illness, which can be especially dangerous for infants and vulnerable populations, is prompting renewed calls for vaccination and vigilance. We'll break down what's behind the increase and how you can protect yourself and your loved ones. Highly contagious whooping cough rises in California to highest level in years. What are we missing? Why is it that despite the advances in modern medicine and a robust healthcare infrastructure, we are seeing a significant rise in whooping cough cases in California, the highest in years? It's as though we've taken a few steps forward only to slide back into a situation that many of us thought was in the past. But is this resurgence a warning sign of something bigger? Something more profound? What is driving this return of a highly contagious and potentially dangerous disease that in the worst cases claims the lives of infants? Whooping cough, or pertussis, is a bacterial infection that primarily affects the respiratory system, causing severe coughing fits. It's particularly concerning because it can be deadly for babies who may struggle to breathe during coughing fits. With the rise in cases, especially in California, we must ask, what is at the core of this public health crisis? Are we underestimating the power of vaccination? First and foremost, the increase in whooping cough cases inevitably begs the question of vaccination rates. Why are we seeing outbreaks in an age where vaccines have almost eradicated so many infectious diseases? Are we forgetting the importance of vaccination? The rise in whooping cough could be directly related to the decline in vaccination rates in certain communities. Despite overwhelming evidence that vaccines prevent outbreaks of deadly diseases, vaccine hesitancy is a growing concern. According to California's Department of Public Health, the state has witnessed pockets of reduced vaccination coverage. Some parents, influenced by misinformation about vaccine safety, choose not to vaccinate their children, believing that vaccines carry risks greater than the diseases they prevent. But could this mindset be endangering the very population they aim to protect? The evidence tells us that the more people who are vaccinated, the fewer opportunities the disease has to spread. Yet even a slight decrease in vaccination coverage can cause disease rates to rise. This brings us to an even deeper question. Have we, as a society, taken our focus off the basic preventive measures that keep our children safe? It's easy to forget the threat of diseases like pertussis when we don't see them on a daily basis. But the resurgence of these illnesses highlights just how fragile our progress can be. How can we recalibrate our priorities and remind ourselves of the crucial importance of vaccines? Is the whooping cough outbreak a symptom of larger public health gaps? Another significant issue the rise in whooping cough points to is the overall state of public health infrastructure in the United States. Why, in a highly developed country, is there such a stark increase in cases of an easily preventable disease? Could the answer be hidden in the way we organize healthcare? While California remains a leader in vaccine availability, there are disparities in how vaccines are distributed, particularly in underserved areas. Families in low-income neighborhoods or rural regions may not have easy access to regular vaccinations or even timely healthcare checkups. Is it possible that we are overlooking these gaps in the system where the vulnerable are left at greater risk? It's important to ask whether access to healthcare and education around disease prevention are being distributed equally across all communities. Furthermore, California has seen substantial challenges in recent years, such as wildfires, homelessness, and the aftermath of the COVID-19 pandemic. These factors have stretched public health systems thin. With healthcare resources diverted to addressing immediate crises, are we leaving less room for preventative care and education? Shouldn't we be asking how to build a more resilient public health infrastructure that can withstand the various challenges that constantly evolve? Could the mutability of pertussis bacteria be a factor? Whooping cough is caused by Bordetella pertussis, a bacterium that can evolve over time. Is it possible that the strain of pertussis we are encountering today is more resilient or contagious than in the past? Bacteria are constantly mutating to survive, and the presence of newer, more virulent strains could be making it harder for our vaccines to protect us. Could this be why we are witnessing such an alarming uptick in cases? While vaccines do remain effective, particularly for infants and young children, they aren't foolproof. The Bordetella pertussis bacteria could be adapting in ways that challenge our current methods of combating it. Is it time for updated vaccines or improved treatments to match these new bacterial strains? We might be facing a situation where medical research needs to speed up to outpace the evolution of disease. Are we failing to learn from our past? Reflecting on the rise in whooping cough cases also leads to another important consideration. Why, despite the lessons of past outbreaks, do we still see diseases like this flare up in the 21st century? Are we truly learning from history? Pertussis was once a common, deadly disease before the widespread use of vaccines, and yet here we are, struggling to keep it under control. When we face an outbreak, are we truly prepared to address the factors that allow diseases to resurface? The challenge is not just about immediate responses to cases, but also about how we build long-term public health strategies. How can we better integrate disease prevention, vaccination campaigns, and community education into daily life so that everyone understands their role in keeping the community healthy? What does this mean for our children? The most pressing question, however, is what will this mean for the children of California and beyond who are vulnerable to this resurgence? Babies under 6 months old are at the highest risk of severe complications, including hospitalization and death. What steps can we take as a society to protect them from the devastating effects of whooping cough? Parents, health professionals, and policymakers all have a role in addressing this rising threat. We need to ask ourselves, are we doing enough to prevent deaths and suffering? Are we ensuring that the most vulnerable, especially infants, are protected through timely vaccinations and awareness campaigns? Conclusion: can we turn the tide? The rise in whooping cough cases in California is not just a warning sign, it is a wake-up call. A wake-up call about the importance of vaccinations, the state of our healthcare system, and our preparedness for evolving diseases. It is a reminder that the fight against preventable diseases is never truly over. We must continuously question our practices, our priorities, and our public health strategies if we are to ensure that future generations are protected. As we grapple with these questions, the ultimate goal should be clear: to prevent another outbreak, to safeguard our children, and to recognize that even small changes in our collective efforts can have significant impacts. We cannot afford to be complacent or dismiss the lessons of the past. The stakes are simply too high. The question remains, are we willing to take the necessary steps to protect the most vulnerable among us from this rising threat, or will we let the tide of complacency continue to rise?